Now we're going to discuss the application of the percutaneous electrode. This is for BioWave pens. So first thing is you've identified where the pain presents. You've identified, is there a single location of pain, two locations of pain. So for this example, we're going to do a bilateral lumbar placement. So the patient has indicated, first you're going to palpate. You're going to find the center of the location of each pain site. In this example, if these are the two locations of pain, we're going to mark those locations with a Sharpie. So palpate, find the center of the pain site, mark it with a Sharpie, palpate, find the center of the pain site, mark it with a Sharpie, and this is the center of where we're going to be placing the percutaneous electrodes. Next, we have to clean the skin with an alcohol prep. This is as if we were going to do an injection. So we take an alcohol prep and we're going to clean the location that the percutaneous electrode is going to be placed. So we clean this whole location, make sure you can still see the center of the Sharpie location. The percutaneous electrodes are sterile, single use. They're in a vapor-proof foil pack. You open them from the top, peel the pack apart, and we've got two percutaneous electrodes. We recommend not wearing gloves while you place these because the gloves will stick to the hydrogel that's around the perimeter of the electrodes. It's easier to place these without. You cannot touch the needle array once you open up these percutaneous electrodes. The plastic cup which protects the needles, that needs to be peeled off, and please do not just yank it off quickly. You want to peel around the perimeter of this electrode. So we peel it back starting where the wire is so that you peel right to where the array, the metal array, starts to show up. Then we peel around the perimeter very gently. I have my 3 fingers on the back of the electrode, and we do not want to kink the metal array where the needles are located. So if you peel it, take 2 seconds to peel it off. We have the array of needles. There's 1,014 needles within this 2.5-inch diameter patch. The needles are 3/4 of a millimeter in length. They're made from a surgical grade stainless steel. And again, this is a sterile single-use electrode, and it has to go in sharps disposal following the treatment. When we place this electrode, we're going to place it with typically the wire running down so the weight of the connector does not pull on the electrode. Do not touch the metal array with your fingers. This is sterile. We're going to place this centered over the Sharpie mark that's on the skin. So we're going to place this directly over that location, and we're going to, just for the time being, touch around the perimeter where the hydrogel is to hold that in place. Now we're going to do the same thing. We have not yet inserted the needle array through the epidermis. We're going to take the second percutaneous electrode, peel it back very gently, go around the perimeter, peel off the cup, and similarly we're going to take this second percutaneous electrode, place it over the center of the Sharpie mark that we made where we've cleaned the skin, place that, and again just use the touch around the perimeter to put it in place. Now you have to ask your patient, if you're in a treatment room with a table or a chair, to brace against the table or chair, because we're going to apply pressure on the back side of the electrode. So, and we have to apply about 10 pounds of force. And we want to start by first placing our thumbs together, centered over the center of the electrode. And we're going to do 3 presses. We're going to press with the thumbs at the center, with the thumbs at 12 and 6 o'clock, not all the way at the edge, but over where the metal array is, and then with the thumbs at 9 o'clock and 3 o'clock, again, not all the way to the edge, but over where the metal array is. So if we do those 3 presses, like in the center, above, and to the side, that will ensure that all 1,014 needles are completely inserted through the epidermis. So we're going to tell the patient, now the needles don't hurt, but we're applying pressure over a painful location on the body because the electrode must be placed directly over the location of pain. So it's a little bit of discomfort for the patient for approximately the 1 to 2 seconds that you're inserting the needles through the epidermis. So are we ready? Mm-hmm. So we're going to press firmly. You can see how much pressure I'm applying. Then we're going to do at 6 and 12 o'clock. Then we're going to press at 9 and 3 o'clock. Okay? So this electrode is now inserted through the epidermis. Now we're going to do the same for the other electrode. So we're going to press now with the thumbs together in the center. We're going to press at 12 and at 6. And we're going to press at 9 and at 3. So that's what it takes to insert the needle array through the skin. When we're done with the treatment, we can remove the percutaneous electrode. You're going to see a pink circle, and typically you'll see 4 to 5 tiny drops of blood. You can take dry gauze, sterile gauze, and clean off any tiny drops of blood that are there. There's no dressing that's required. The pink circle resolves typically in about 1 to 2 hours post-treatment. If the patient has very sensitive skin, it may take 24 hours for the pink circle to resolve.